Okay, so my name is Takahiro Kato from Kyushu University Hospital, and I'm an expert of Hikikomori. So I briefly answer the pre-questions from your universities. At first, I show you how to assess Hikikomori briefly. So we are trying to define the Hikikomori. At first, about 5 years ago, I choose four criteria for physical withdrawal, don't contact others, and duration more than 6 months, and have some distress. And just recently, we have revised the Hikikomori definition and published World Psychiatry this year. So this is our proposing definition of Hikikomori. The main 3 point is marked social isolation in the home, and the duration of continuous social isolation for more than at least 6 months, and significant functional impairment or distress associated with social isolation. So in this criteria, we have several specifiers, which is very important to assess each individual with hikikomori conditions. So, and also it's very important, hikikomori has a variety of comorbidity mental disorders like depression, personality disorders, and also schizophrenia. And we are now proposing that social withdrawal with depression and without depression might be some different. And I'm also focusing on depression in Japan. About 20 years ago, a modern type of depression has been proposed by a Japanese psychopathologist. He defined this kind of six criteria, mainly young generation and attachment to oneself to less loyalty for social structure and for example, negative feeling about social order models and some omnipotence and not hard work by nature. So the main interesting behavior is that youth with modern type of depression tend to feel depressed only when they are at work or at school. And we have some link between modern type depression and hikikomori. So they tend to avoid the school or working place easily and less resilient, and this kind of prolonged social avoidance result in hikikomori like this one. So our recent survey suggests we have just recently produced a self-rated questionnaire to assess the modern type depression trait quickly, only 22 items of questions. So three components is highlighted: avoidance of social roles and complaint tendency and low self-esteem. And interestingly, this year I have published one paper based on my clinical data, major depression with hikikomori or without hikikomori. We compared the two groups, and we found that MTD patients with hikikomori had high tendency of modern depression traits. And now we are thinking that hikikomori is, of course, have some comorbidity with mental disorders. However, some of hikikomori has no psychiatric disorders. However, they have some higher loneliness or high sense of shame, low trust, and low self-esteem, and some cultural background we found. So I'm very much interested in Italy also have similar hikikomori behaviors among youth. So I'm very much happy to talk with your expert in Italy. And also another perspective is biological factors also might be important to understand the Hikikomori. So my clinic, we are focusing on both all the aspects of components is important. So to treat, finally, I briefly talk about the treatment of Hikikomori. Of course, if they have some comorbid with mental disorders, for example, each guideline might be useful. However, as shown in the depression case, hikikomori with depression and hikikomori without depression have some different therapeutic strategy are needed. So, for example, this kind of psychological factors are important in the process of hikikomori and rescue of hikikomori. So, psychotherapy, CBT, and psychodynamic psychotherapy are both important. For example, in my clinic, I'm doing psychodynamic group psychotherapy for hikikomori patients and also CBT-based family intervention program. So both such kind of psychotherapy-based intervention are necessary. So this is a summary of my understanding of hikikomori. So next year's workshop, I hope to discuss about this kind of the hikikomori in Japan and also in Italy. Hope to see you next year. Thank you.